Hi, I'm Lanette Creamer, and I wanted to ask, how you doing? When I ask, how you doing, you might be reminded of Joey from Friends and that's his famous pickup line. He asks people, how you doing? And I'm not suggesting that you use cheesy pickup lines on your colleagues at work. But I learned this year that your boss is more likely to impact your health than your doctor is. So, considering that, why isn't anyone covering the basics to look out for mental and physical health changes during a global pandemic? So, how are you doing? 4 in 10 adults have reported symptoms of anxiety or depression during the COVID pandemic, up from 1 out of 10 during a normal year. Have you tried getting in to see a therapist? I thought I was feeling somewhat bad mentally. But when I went to get help, the expense and difficulty of getting into therapy made me feel much worse. If it's difficult for those of us who have higher than average income and are very privileged, who is the system working for? Because it doesn't seem like it's working very well. Third, I wanted to tell my story about how you can go from being fine to not okay faster than you might imagine. And then fourth, your physical and mental health are tied together. If you experience a decline in one, you may also experience a decline in the other because they're tied together. So who gives a crap? I got to a point where my only thought when I would think about the upcoming quarter, the upcoming year, is I just don't want to do this anymore. And I did not feel okay. But what do we do when we're not okay? So in my case, I was able to go on medical leave, and I'm very glad that my company supported me in doing that, because I went from feeling a little bit tired and unwell to being unable to walk entirely and being numb from my armpits down. And I had a very hard time getting help. When you have a issue, whether it be a physical or a mental health issue, it's tricky to know who to disclose the problem to. Legally, companies are not supposed to be biased against those who have physical and mental health challenges, but the results may vary depending on what company you work for. And it can be tricky as far as knowing how much to disclose and when. I returned back from work and I was feeling physically some better, but mentally I still felt like I just did not care as much as I did before. And I was feeling like I still don't want to do this again. I was feeling like I was not okay mentally. And I was feeling also that if this is what my life was going to be like, I didn't know if I really wanted it anymore. But I discovered that my life and your life and health are worth more than your job. Also, your purpose here on earth is more than making money for someone else. You are not just a cash cow for others to rely on. I learned this past year to work while crying. So basically, I could work with no less efficiency, even though it was a little bit hard to see what was on the screen when crying. But this is not a skill I want anyone else to learn. It is not cool to have a job where you are crying regularly. You are not okay if that's the case. And you need to get some support so that you can be feeling more okay, if that's the case. Small things helped me get to a better mental and physical health state. The first thing that helped is snuggling with my cats. And we all as humans need touch. But during the global pandemic, the small things like hugs and handshakes have even gone away due to safety. And the third thing, if you've tried to fix things and they're not getting better, you need to find a new job. And that is your responsibility. And it's scary and it's hard to find a new job. And you don't want to jump from the frying pan into the fire. And there's a lot of reasons why it's hard when you have a job that should be good if it's not working for you to actually leave. So have you asked your employees how they're doing? Because if you really listen and you hook them up with appropriate care, you might save their life. But what if I'm not sure how to help? What can you do? I like rubber ducks in programming because I think they're excellent tools and they have a long history of helping programmers by just talking out your problem. So I have a couple ducks. The average size duck is for normal programming problems, but I also have a tiny duck, and he's like if I can't find a missing semicolon or if I have a typo, something like that. But you can help and make sure that you're doing no harm with the guideline to just be better than a rubber duck. And by that, I mean actually care for the person, listen to them, and repeat what they told you back to them to help them hear what they're feeling, what they're saying. Don't change the topic to your experience, but literally listen to them and try your best to help them. Now, in addition to active listening, we have the GAD-7 for anxiety and the PHQ-9 for depression. And these are tests that are given by licensed therapists that basically are just about, are you experiencing symptoms of anxiety and depression? But if you don't have access to those tests, active listening is better than nothing. You can find these tests online for free at patient.info, and you can just take them and see if you are experiencing enough symptoms of anxiety and depression that it's recommended that you seek therapy for the situation. So I wanted to leave you with the checklist of things that may help. So first, ask the question, how are you doing? Then listen. Be the rubber duck. That means be an active listener. Don't interrupt. Reflect back what they're telling you. Don't change the topic to the experience you had, but listen to what they're telling you. If it's possible for you to do this, understand how your physical and mental health benefits work, how your insurance works. And this is so you can guide someone through it so they can actually get into therapy sooner. This may be an iterative process. You may be able to iteratively improve your mental health benefits or physical health benefits. And do not stop asking. We need to care more for one another during this pandemic because a lot of people are not doing okay. If you have any questions or you want to see my references for those items that had the small numbers in the superscript, feel free to email me at lanettekremer@gmail.com.